Whether or not you know it, change is coming. Change is coming to the plans that we offer to MDA members and to the staff of MDA members. If you're lucky enough to maybe have your health insurance, if your spouse works at GM or maybe as a teacher or something like that, maybe your health insurance might not be changing. But those of you who work in a business that employs less than 50 people, which most dentist offices are, our health insurance is changing, and so it's important that you're here today to kind of find out what's going on. The one takeaway we want you to have out of this whole event is that we're here for you. We're here to help you through it. We're here to help you get the answers. We're still here to be your insurance agent for health insurance, but things are going to change. We do think that we're going to be able to provide superior service, better products, better pricing than what you're going to see out on the government market. With the history of healthcare reform, you know, I think there was a lot of people who were maybe hoping it was going to go away. You know, we thought maybe the Supreme Court was going to strike it down. And then we thought maybe that, you know, the presidential election might go differently than it did and it might go away. But neither one of those things happened, right? And so at this point, as we're standing here today, it's the law of the land. It's not going away, and it has very serious implications for all of you who have your health insurance with us. Anybody who works at a business that employs 50 or less people, and we're going to get into this a little bit because it's not as highly publicized as it, for my opinion, should be, the fact that your insurance is going to have to change. So I'm sure nobody here was this guy the last 3 years with their head in the sand, but if by any chance you were, okay, it's time now to get our heads out of the sand and start to understand that there is going to be serious plan disruption, premium disruption, coverage disruption if you work in a business that has less than 50 people. This may come as a surprise to you, but all existing Blue Cross Blue Shield products, all of them, in the under 50 market and in the individual market are going to be discontinued somewhere between January 1st of this year and January 1st of 15, okay? So nobody gets to keep what they have if they like it if you work in an under 50 business, okay? So, and this is not just unique to Blue Cross Blue Shield. This is all carriers in the under 50 market, and we're going to show you, we're going to give you the details behind this as we go through, okay? So what we're here today really is to explain a little bit about how we got here. I'm going to bring Tina up in a minute. Has anyone come to our seminars the last 2 or 3 years at all? Okay, so Tina's going to cover in 10 minutes what we've been spending an hour or two talking about at the last couple meetings so that we have time to talk about the future and where we're headed, okay? So she is going to come back and go over that very high level, what's been going on the last 3 years. We're going to explain what these new laws and rules mean to the current MDA plan and what we're doing about it and what your options will be for the future as we go forward. So that's what we're here to do today, and we hope that you'll come away with a lot of good information. And as I mentioned earlier, we hope that the main thing we want you to walk out of here is remember, we're here for you. We still want to be your health insurance agent and advocate, and I think we're going to have a good portfolio of programs to offer you compared to what else might be out there. So with that, I do want to bring up Tina.
As Craig said, I'm going to give you the history of the last 3 years in about 10 minutes. I will go slower than what most of you are probably used to hearing me at. But we've all heard Patient Protection and Affordable Care Act. It was signed into law back in 2010. And as Craig had mentioned, it had actually tried to be overturned over 40 different times. It is the law of the land, so we're going to move forward and explain what has happened along the way. Basically, the law came so that we could add additional insureds and get insurance for the underinsured. All right, the PPACA objectives were really access to care, to get qualified care for everybody, to simplify the product choices. Noticing all of the plan changes are ending at the end of this year or at the end of next year. So it's to simplify the product choices. Craig's going to talk about metal tiers. You're going to hear a lot of that when it comes to healthcare reform. All of the new insurance products have to have a metal equivalent associated with them. And then regulated insurers. The community rating, as we're trying to talk about, is going to also go away. Right now, for those that are in our Blue Forever Life Plan, you are community rated with member dentist and staff. So we're our one little pool. And with healthcare reform, we have to no longer be our own little pool. We have to be the pool with the rest of the world. And Craig's going to explain that a little bit later, because that really goes into effect 1/1/14. And then the shared financial responsibilities, we will get into that in a little bit later. We have to pay for this somehow. And how do we pay for things in this world? Taxes. All right, so way back in 2010, MDA, along with other insurance companies, had to lift their lifetime dollar limits. Those were eliminated. We used to be a $1 million policy way back when I first started. Then we moved it to a $5 million policy. And then in 2010, we had to remove those limits, so now they're unlimited policies. They restricted yearly limits. We talked about that a little bit way back in 2010, maybe when you talked about mental health care. They had a limit of like $5,000 or $25,000. All of those limits have been removed again because you're removing the maximums. And then coverage rescissions and cancellations. We've never done coverage rescissions and cancellations within the MDA world. The only time your policy gets canceled is if you don't pay your premiums. And then the zero cost sharing for preventative. We've always kind of been ahead of the times. We've always had preventative care on our policy. We've always increased our benefits prior to usually the government telling us we have to. And now it's just where it went from $100 to $300 to $500. Again, it's unlimited with the specific coverages. We got to add our dependent children on and keep them on until they're 26. This includes married children. You can't put grandchildren or their wives on the policy, but you can keep your child on the policy through the age of 26. The enhanced appeals process, probably nobody's ever noted that, but claims have to be paid in 30 days. If you send an appeal, you have to get a response within 10 days, and then they have 30 days to respond to it. So everybody in the insurance industry is under the same appeals process. And then pre-existing. Our policy has always been medically underwritten, and we did used to underwrite children. Again, in 2010, we removed the medical underwriting for children under the age of 19. All right, up to 2011. For those that are over 65, you heard a little bit of talk about them closing that donut hole that they talk about a lot when it comes to a prescription drug plan. So they added a 50% discount. You still have a larger donut hole, but by I think 2020, they're supposed to close it. The voluntary long-term care insurance, big talk in 2011. This was one of those things that actually did get rescission and actually got removed completely from the law. And then medical loss ratio, the MLR. This just means that the insurance company must spend 80 cents out of every dollar on a medical claim, or 85 cents on every dollar if you're in a large group. And if they don't, then they owe money back to the insureds. If you have Blue Care Network, you may have received a letter. They did actually give some money back. I never saw how big or little or what it was. I just know the confusion was out there. Okay, in 2011, we also had rate review rules. If the insurance goes up more than 10%, the CIO for the federal government can actually investigate why you think more than a 10% rate increase is necessary. And I think there's a little bit of talk on that in the news when a couple agencies said 13, 14%, they'd go in and look and see why, claims and utilization. And then W-2 reporting, I believe Craig will hit on this just a little bit. This was postponed, so unless you're an office that issues more than 250 W-2s, you do not have to do anything with this right now. That's a lot of W-2s. All right, then 2012, we have, everybody probably in this room got one, maybe two from me, Uniform Summary of Benefits. The SBC is a nightmare of paperwork. It is your benefits at a glance, what you're used to seeing for the last 20 years. The SBC is what you pay. The benefits at a glance is what the insurance company pays. So the government thought you needed it simplified, so it's in 8 pages. Every page is identical, so if you look at an SBC on a Community Blue 3 and an SB3 or an SBC for an Aetna plan, what's on page 1 of mine should be the same on their page 1. What's on my page 8 should be on their page 8. It's to make it so it's unified and everything's simplified. This is also the document that if you issue insurance, you need to make sure that your employees get. Then the no annual fees on pharmaceutical. This was just another little tax that was hit to the pharmaceutical companies, which again, got passed to us if we buy those drugs. And then the women's wellness benefit. This took effect last year, and this was just an increase of what was already out there for women's wellness, mammograms, pap smears, pap mirrors, screenings. This just added additional breastfeeding supplies, counseling, and some additional screening benefits. All right, in 2013, catching up, I think I'm over my 10 minutes. So your Medicare this last year, those that are a high income earner, had to pay an additional 0.9% Medicare tax. The flexible spending account, or your FSAs, had to be limited to $200 or $2,500. You may have put more in there. This is different than a health savings account or a health reimbursement account, just as we'll talk about those in a little bit. But the flexible spending account's the only thing that's limited, not your HSAs. Itemized deductions, and then the 2.9%, we spent a lot of time on this last year, the medical device tax on the manufacturers. This did impact some of our dentists that make stuff in their own offices. And then, of course, the dental labs probably passed it along to you as well. All right, that's 10, 11, 12, and 13 in a review. Craig's going to come back up and give you 2014.